What's up, people? Welcome to episode 71 of the unofficial NCLEX podcast. I am your host, Katie Kleber. So this episode is entitled Apply Principles of Infection Control. And again, this is part of the kind of infection control section of the NCLEX. So a couple big points: hand hygiene, surgical asepsis, isolation, and universal or standard precautions. But let's talk a little more specifically about those. So hand hygiene. Come on, guys. This is Nurse Life 101. Washing our hands, when we walk in the room, when we leave the room, before, and after touching stuff, but using the gloves consistently. Hand hygiene is essential, and it's not just, you've got to have soap and water for 26 seconds or something like that. So making sure you're doing that appropriately. Next thing, surgical asepsis, so sterile technique. As a nurse, you do a few sterile procedures that are pretty consistent. Let's see. Foley catheter insertion is a very common one that is a sterile procedure. A central line dressing change is a sterile procedure. And the way that you can kind of know if something is a sterile procedure versus a clean procedure is if the policy requires you to have sterile gloves. So that's kind of how I have it in my mind, because you're creating a sterile field and, you can't touch other things on there if they're not sterile. And so, that is a challenging thing to get used to, but putting on the sterile gloves and making sure you're only touching things that are within this sterile field, wearing a mask, people aren't reaching over it and that kind of stuff, those kind of things. If you spend any time in the OR, that's kind of a great place to observe people doing this, because, it takes a little while to learn. It takes a little while to get into the habit of it, but, it's cool watching people that are really good at it and just do it kind of seamlessly. And kind of paying attention to little tips and tricks that they do. So that is an aspect of infection control, is surgical asepsis. So the next thing is isolation precautions. So like we had talked about in the previous episode, someone may be on airborne droplet, contact or enteric precautions. So they must have an appropriate room assignment, most likely a shared private room. I feel like many of the hospitals I have had experiences with, the majority of the rooms are already private, but various ones require you to definitely have a private room, or if not, it has to be a shared room of someone with a similar organism or a similar pathogen. If not on airborne precautions specifically, we got to make sure the room is labeled appropriately. So we want to communicate the level of isolation, but without violating HIPAA. So we can put on the door, this person's on airborne, droplet, contact, or enteric. That's okay to put on there, but we can't put on there VRE, MRSA, C. diff, measles, tuberculosis. Like, you can't put that. That's a little too much information. The anyone walking in that room, what they just need to know is the level of precaution, and it's up to the patient who knows why they're on precaution. It's also important to educate the patient and family about utilizing PPE. It's kind of so if a patient has something with airborne precautions and droplet precautions, that's a little easier for the family to understand and say, okay, I have to wear gowns and gloves and a mask, and a specific mask. But I find that patients that are on contact precautions, especially if it's because they have a colonized organism like MRSA or VRE, I find that it's more difficult to elicit consistent compliancy from the family, because they're like, well, I'm not wearing gowns and gloves when I go home. Like, it's not like he's actively infected with MRSA, So that's kind of challenging. So we have to make sure we're educating them appropriately, and also educating them about how to use the PPE or personal protective equipment appropriately. I can't tell you how many family members, the gowns typically are disposable, one-time use. I mean, most things in medical world are one-time use, which makes sense. But, you got the little old ladies or the people that are like, this is so wasteful. You can only, I'm just going down to the bathroom. I'll be right back. I'll put it right back on. And, convincing people to use it appropriately and just get a new one. It's okay. I promise. So that's an interesting thing to educate about contact precautions that I never thought I would have to do. So the next one I want to just briefly talk about is universal or standard precautions. So what does this mean basically? So the best way to describe this is basically treating all bodily fluids and whatnot, like any fluids, like it's infected with a bloodborne pathogen. So, you're not touching somebody's blood purposefully, with a non-gloved hand, because you don't know what's in, you may actually know. You may know they don't have HIV, they don't have hepatitis, they don't have blank, blank, blank. You may know that, but we have to treat it like we don't know that. So all the blood, all the fluids, we handle with utilizing gloves and hand hygiene. Although, side note, I don't know why you would want to touch any bodily fluids voluntarily without a glove on. And this is one that it's not hard to promote with nurses, because we know this is gross to just touch blood or bodily fluids, without, a glove. But that's basically what it is. Bloodborne pathogens, they can live on surfaces for days or weeks at a time. So it's really important that we're cleaning up spills promptly, and that we're treating any bodily fluids like they're infected. Because at the end of the day, we may know a little bit, but you never know for sure. So you want to make sure that you're using universal or standard precautions. We just pretend everyone's got HIV, pretend everybody has got Hep C, and you treat their bodily fluids accordingly, and that's by using gloves and hand hygiene and, cleaning surfaces as appropriate. So that's that, guys. Episode 71 that concludes the episode. It's entitled "Apply Principles of Infection Control," and those 4 bigger things we talked about were hand hygiene, surgical asepsis, isolation, and universal or standard precautions. Thanks, guys.
This has been another episode of the unofficial NCLEX Prep Podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEX-Prep. That's nrsng.com/NCLEX-Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at nrsng.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.